Well, it's been a while since I actually posted some video on the platform here regarding more information about the job, what I specifically do in the operating theater. And I wanted to, today at the very least, post something regarding more educational information for those who might be interested in pursuing a career in surgery, regardless of what the profession is. The operating theater has a lot of interdisciplinary aspects into it, and it makes it very different from other clinical settings in medicine in the sense that you have a lot of these different professions in the same room contributing to the same goal, which is ultimately the patient's safety and satisfaction during the surgery and making sure the surgery goes as safe as possible. So with that, I wanted to kind of share, at least within my experience, of the different types of professionals I have seen within the operating theater, so that it gives those maybe who are curious a better idea of what goes on in the operating theater, or if they're interested in maybe pursuing one of these careers themselves, it can give you some insight as to the very least of what they do. So without further ado, let's get started. When it comes to the operating theater, the first person you might think of is the surgeon. So there are most of the time multiple surgeons in the operating theater. So what they typically mean is the attending surgeon. So the attending surgeon is the surgeon who has gone through medical school, completed surgical residency or a relevant fellowship, and is now a board certified surgeon able to practice and provide surgery within their specialty autonomously. They're obviously the ones who initiate the surgery, as they're the ones that primarily speak with the patient, and they make the relevant diagnosis and inform the patient's health status of why they would need surgery and why surgery would be warranted. They'll typically round on the patient before surgeries and also after surgeries. They also will sign the informed consent and will make sure that surgery is obviously performed in the operating theater. They're the ones manipulating all the tissue with sectioning, retracting, cutting tissues, suturing, and doing laparoscopic and robotic procedures. They also make follow-up appointments with the patients after surgery to make sure that they are recovering well, and if they have any other further medical concerns, to follow up with them and address those problems as needed. The next profession is the surgical first assist. So the surgical first assist is kind of exactly how it sounds. They are the ones who assist the attending surgeon during their case, and they have roughly the same scope of practice as the attending surgeon. They'll only do stuff that the attending surgeon, however, wants them to do. They just can't be doing things autonomously because they're not independent surgical providers. So they will also help with suctioning, retracting, cutting tissues, suturing, doing laparoscopic and robotic procedures alongside the attending surgeon, because surgery is a team effort and the attending surgeon cannot do most of the surgeries by themselves. Typically, a surgical first assist is somebody who is either a surgical resident, meaning they are a doctor who has completed medical school and are now in residency trained to become a particular surgeon. And most other hospitals also have physician associates or nurse practitioners that can also act as first assistants. These will typically be at more major hospitals or more well-renowned hospitals. Most smaller hospitals may have other surgical first assists in addition to the ones I mentioned. Registered nurses can be first assists, as well as surgical technologists. They can also be first assists. They would have to go through a certification once they have several years of experience in their current profession. And they also have the same scope of practice as other first assists. A good first assist should know the procedure of the surgery, make sure the attending surgeon trusts what they're doing, as well as knowing how to manipulate tissue, know the relevant anatomy, and the operation itself. The next profession you may see in the operating theater, specifically in cardiac surgeries, are perfusionists. The reason why you don't see perfusionists in other specialties outside of cardiac surgery is because in cardiac surgery, all the blood that is needed to supply the body is typically run through a heart-lung machine, so that the surgical team can perform surgery on the heart without having all this unnecessary bleeding. The perfusionist role in cardiac surgery is to make sure that all the blood in the heart-lung machine is getting oxygenated and is being given back to the patient through different tubes and lines that they create that bypass the heart itself. Cardiac perfusionists typically go through a 1.5 to 2 year master's program in perfusion studies in order to become a perfusionist. In my hospital, there's only 2 perfusionists because we only have one operating theater that is performing cardiac surgeries. But typically, you'll only find perfusionists in cardiac surgeries whenever a heart-lung machine is needed to bypass all the blood. The next professional is the scrub person. The vast majority of the time, most hospitals have surgical technologists perform this role because surgical technologists go through a certification program learning how to specifically scrub in surgeries. So most of the time, the person scrubbing is usually a surgical technologist. The scrub person is the first person to scrub in as they set up the whole sterile field, they set up the instrumentations needed for the surgery, as well as ensure proper equipment is needed for the case. Some hospitals also allow nurses to scrub in as well, such as the one I'm training at. However, because nursing school does not teach nurses how to scrub, nurses who go into the operating theater and are allowed to scrub mostly learn from the surgical technologists or other scrub nurses with experience on how to scrub in surgeries. They mostly pass instruments to the attending surgeon and the first assist. They require a similar amount of knowledge as a first assistant does. However, they are more focused on the particular surgical instruments and machines used during surgery rather than the anatomy and more the surgical case itself. Sometimes, if the attending surgeon does not have a first assist, the scrub person may act as both a scrub and a first assist. However, they might not be able to do a lot of procedures as first assists do, such as cutting tissue, suturing, or using any laparoscopic or robotic instruments, as those are only done by the first assists and the attending surgeon. There actually have been a few cases where when I was training in the scrub role, did help actually in the surgery and manipulation of tissue, but obviously the surgeon knows that the scrub person is not fully qualified and trained to do a lot of those procedures that a first assist can. The next role is the circulator. The circulator is basically the manager of the operating theater within that particular room. I'm not talking about the whole hospital, just that particular room. Only nurses are allowed to be circulators, as surgical technologists can only perform the scrub role. Just like the surgical technologist, the circulator helps the surgical technologist get ready for the surgery before everybody else comes in, and typically stays after as well. And they also help the scrub person with surgical counts to ensure no instruments get stuck in the patient, as well as get medications that will be used for the surgery. The circulator also goes to the pre-op room to make sure the patient is ready for surgery and has signed informed consent, as well as any other relevant concerns that need to be addressed to the attending surgeon. They also wheel the patient into the operating theater and help position the patient to the operating theater's bed. The circulator also initiates a surgical timeout before each case to ensure the correct patient, procedure, and concerns are addressed and verified. During the case, they document the surgery during the electronic medical record to make sure that the surgery is going well, certain supplies that are used are documented, as well as certain timestamps that the surgeon wants. So they'll typically document things like incision time, timeouts, who's in the operating theater room, who left the operating theater room, who's coming back in the operating theater room, as well as the protocols and procedures necessary to keep the surgery going are also documented. Whenever supplies are needed during the surgery and it's not in this, and the surgical team doesn't have access to it immediately, they will call the circulator to get that particular supply they need, which is typically in the substerile room or the supply room. So the circulator will kind of go outside the operating theater, get the supply, and then give it to the surgical team. Post-surgery, they help with the patient, and they help put the patient back onto the stretcher from the operating theater table and give report to the PACU nurses in the post-operation recovery room. The next profession is the anesthesiology provider. So anesthesiology providers typically are three professions. The most typical one most might think of are physician anesthesiologists. They go through medical school and finish an anesthesiology residency in order to become board certified in providing anesthesia to patients. Other anesthesiology providers that are now on the rise include certified registered nurse anesthetists or CRNAs. They typically have a couple years of experience in the intensive care unit prior to applying to a CRNA school, which lasts about 3 years, and then they become board certified to provide anesthesiology alongside a physician anesthesiologist. You also have anesthesiologist assistants. Anesthesiology assistants are not recognized in every state, but it is a profession that is slowly growing and it's becoming more recognized throughout the United States. They can perform the same roles an anesthesiologist and a certified registered nurse anesthetist can. The only difference being that they cannot practice autonomously within the operating theater. So anesthesiology assistants always have to have a physician anesthesiologist or a CRNA supervise them during anesthesia. And they typically go through a 2-year master's degree in anesthesia assistance in order to provide anesthesia. The anesthesiology provider will look at the case prior to surgery and inform the attending surgeon if the patient is, number one, safe to undergo surgery, or if there may be certain concerns in the medical history or the surgical or the risk of the surgery to potentially cancel and either reschedule the case until the patient is more healthy to go into surgery, or just to cancel the case altogether. If the surgery is approved by the anesthesiology provider and the surgeon, they'll also help round on the patients in pre-op along with the circulator nurse and also wheel them to the operating theater bed. They help with the patient positioning along with the circulator, and they'll also give medications to their IV to induce the patient under anesthesia. And then once the patient is unconscious, they intubate the patient typically as a circulator is assisting with intubation. And then they'll give the all clear once the patient is fully intubated and fully unconscious in order for the surgical team to start their surgery. During surgery, the anesthesiology provider monitors the cardiopulmonary status of the patient. They also give medications during surgery to continue to sedate them if they are seeing the patient starting to slowly wake up or any pain recognized by the patient as indicated by physiological indicators. And they'll also help move the OR bed during the surgery as the surgeon prefers in order to make it easier on the surgical team. Once the surgery is all done, they will extubate the patient, meaning they will remove the breathing tube out of them and help the patient wake up until they are in a state where they can recognize commands. And then once they are in that stage, they will transfer them alongside the circulator to the stretcher and go with the circulator to the post-recovery room to give report to the PACU nurses. The next profession are anesthesia technologists. Anesthesia technologists undergo a certification, kind of like surgical technologists do. However, the only difference is, as surgical technologists are assisting surgeons during the surgeries, anesthesia technologists assist anesthesiology providers during surgeries. Their job is to mostly monitor and help with the anesthesia machines and make sure that any malfunctions within the machines are running appropriately and are addressed. They also clean the machines and hook up new items after the end of each surgery to prepare for the next one. The next profession is vendors or sales representatives. So these are device salespeople who are employed through specific companies like Stutz, Stryker, Ethicon, and other companies that have a historical connection and a historical service with most of the surgeons and with most hospitals. So when they're in the operating theater, they will guide the surgical team on how to properly use the particular device that their company has given. So during the case, if the surgeon has any questions or issues, or even if the first assist or scrub person has any concerns, any of them can talk to the vendor or the sales representative, and they can give them the necessary information needed on how to properly use the device to ensure that it's safe for the patient and the surgery is running smoothly. Typically, what I've noticed is every surgical specialty has a vendor or sales rep to assist them with the devices that are used. However, the vast majority of vendors are going to be in orthopedic cases or podiatry cases. You don't see a lot of them in general surgery, in GYN, or urology. It's mostly in the surgery regarding x-rays and bones that you're going to see vendors. So the next profession is environmental services. During turnover in the operating theater, there's a lot of tissue and body fluids that are all around the floor and maybe even amongst the walls or certain tables or machines. So during turnover time, they're going to help clean up that mess and make sure the operating theater is clean and sanitized prior to the whole team coming in to start the next surgical case. They'll also help make the patient's stretcher neat and tidy when it is not in use during surgeries. The stretcher is typically placed outside the operating theater whenever a patient's in the operating theater so that other staff know that there's a surgery going on. And during that time, the environmental services will make the bed all neat, tidy, and clean. The next one is not really a profession. It's just kind of expected in the operating theater, especially in teaching hospitals, and those are students. So obviously the name implies they are people who are learning to become a particular profession in the operating theater, and one of the best ways to teach them as part of their education is for them to shadow a day in the operating theater or to have a rotation in the operating theater. So in teaching hospitals, they really like to have surgical residents or students in the operating theater, but you're not going to see them in non-teaching hospitals as those are mostly staff who have experience. They have a limited role in the operating theater since they're mostly observing and do not necessarily have the training or experience needed to do things more autonomously. However, those that have gained the trust of the staff in the operating theater may be able to perform more of their roles during the surgery. For example, these could include medical students who have been in the operating theater multiple times. They may not be able to suture the first day or two, but over time, as they develop more trust and autonomy in their surgeon, they might be able to suture after the end of each case and help close. Last but not least, we have administration. So these are obviously professionals within the administrative side of the hospital. These include charge nurses, nurse managers, anesthesia chairs, and higher ups in the medical hierarchy, such as surgical chairs, chair of surgeries, nursing and medical supervisors, nursing and medical chief officers, etc. So they typically coordinate, schedule, reschedule, and monitor the status of the entire operating theater staff at a given hospital. And it's not just in one operating theater, it's the whole unit. They create and enforce policies as well that impact all the operating theater staff, as well as what they're allowed and not allowed to do as part of their professions and within the operating theater itself. Because most of them focus more on the administrative side of things, they're mostly sitting in their offices in a laptop and typically in a lot of meetings and discussing policies with other professionals, other administrative leaders within the hierarchy. Therefore, they don't get a lot of time spent in the operating theater itself. Basically, the trade-off is as one starts going to more of the administrative role of operating theater, whether that's nurses or doctors, they're going to have less time in the operating theater as they're focused more on the financial aspect of the hospital and other administrative burdens that they have to endure. That's pretty much it, at least from what I have. If there's anything that I may have missed, you're more than welcome to let me know. Hopefully, I did a good job in the sense of at least educating you on all the positions in the operating theater and also seeing if this is something that you may want to do. Perhaps you are a very young student or maybe you're transitioning into careers. My hopes is that I at least gave you a glimpse of what it's like in the operating theater coming from my perspective as an operating theater nurse, since nurses actually coordinate with all the professionals during the operating theater. Many thanks as always, and cheers.